Does your medical policy cover some dental procedures? Maybe yes, but mostly no. Let's find out which are covered and which are not. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. But first, a disclaimer. This only applies to adults on your policy. Why? Because children are lucky enough to be covered under your medical policy for dental care. This is because of Obamacare law forcing your insurance company to cover your kids' teeth under the same policy. But for adults, dental benefits are usually not covered under the medical benefits. They are actually listed as a specific exclusion. An exclusion being a type of service or supply that are specifically excluded from coverage and therefore from payment by your insurance policy. For example, prevention such as exams, x-rays, cleanings, or fluoride treatments, but also consultations in case of a problem, x-rays to determine the extent of the necessary treatment, how to fix it, and maybe even have some molds or mottles. Do you need fillings, a tooth removed, restored, or replaced? Crowns, root canals, implants, and dentures are also exclusions, as are braces, mouth guards, whitening services, and even snoring devices. Should you bite or chew resulting in a broken tooth, that is not covered. If you need dentures or need to accommodate them for a more comfortable setting, it is not covered, and neither are any cosmetic enhancements. But the good news is, as everything in healthcare, there is an exclusion to the exclusion. For adults, benefits are available for outpatient, meaning in a dental office, hospital setting, and for professional services rendered by either a dentist or a doctor for treatment of jawbone or jaw joints issues and the adjacent tissues. Let's get into details. First, cleft palate or any craniofacial anomaly is covered under the terms of your medical policy. So, surgery to correct a deformity affecting the jawbone is a payable procedure. Any treatment for an injury to the jaw, as well as the treatment of an injury from chewing or biting, but not resulting just from biting on a nut, but resulting from a specific medical or mental condition. General anesthesia is also covered, as well as any necessary inpatient or outpatient facility charges, if the member is developmental disabled or if the member's well-being and health could be compromised if general anesthesia were not administered. TMJ is often a condition that brings up questions. Is it covered? Is it not? Well, the surgical treatment or non-surgical treatment is usually covered. However, the extent of the associated services may bring a question mark. As for treatment of lesions or biopsies, even the removal of tumors, the incision or drainage of an infection of a soft tissue in the jaw, usually considered medical conditions and therefore covered under the terms of your medical policy. Services necessary to prepare a mouth for a medical intervention, surgical intervention, transplant, or for treatment such as radiation are also covered under your medical policy. Now, how to make the difference between what is covered and what may not be falls under the different tips I have for you today. Unless an emergency has a reason, I always recommend to get as much information beforehand as possible. Ask the dentist's office, the medical provider, such as an oral surgeon, any financial counselor at a surgery center or hospital, and of course your insurance. What is the coverage for this particular procedure? Is it a covered benefit? Is my medical or dental policy going to be used? And is an anesthesiologist going to be involved? To get some peace of mind, ask for a pre-authorization to be obtained. First, it will establish whether your medical or dental policy accepts responsibility. It will help confirm what benefits are covered and to what extent. It will help you calculate your financial burden. And in some cases, for example, in California, state laws may guarantee a payment once an insurance has issued an authorization. Get it in writing. The Medicare model applies to the whole of the healthcare system. If it is not written, it does not exist. An estimate of cost from the office or an authorization from your insurance will bring you not only peace of mind and establish the responsibility of provider and insurance, but also can guarantee that your rights are applied as well as be used as evidence in case an appeal needs to be filed. I personally never signed up for any extensive dental or jaw-related work until I have something in writing that gives me an indication of how much my share of cost might be and some form of confirmation or guarantee that either my dental or medical policy are ready to step in and make payment. A little advanced work will help minimize surprises in the future and let you focus on your full recovery. I thank you for watching. Your likes, subscribes, comments help this little channel grow a little bit at a time. And for that, I am most grateful. Thank you.